These women mobilized across the country to build a game-changing platform that's helped the world combat COVID and understand it better. And now, with nearly every 1 in 5 U.S. adults still suffering from COVID-related symptoms, this platform holds the key to understanding what long COVID is and how to help the millions of people still struggling with it every day. Here's a sneak peek at the inspiring women and the treasure trove of information they created with health systems and hospitals across 49 states and an army of more than 4,000 volunteers. It all started when COVID was killing thousands of people each day. The world literally shut down. No one knew what to expect. And then there was a phone call.
When I got the call, we were really at the very beginning of this whole mess. Most of us were terrified. And the idea of just going about my job and the things that I was researching at the time and the priorities that I had at the time seemed very strange in the face of this horrifying future that we were facing.
It's like, okay, we're home for a little bit, and then it turns out, okay, we're not going back. And then it's just that fear of like, how long is this going to last?
It's very quiet, almost eerily quiet, right? Because everybody was in the house because they weren't allowed to go outside.
We are panicked here, but if we got this data, so we know the data can help us to address some of the questions.
It was all hands on deck, with data scientists across the country teaming up to find out as much information as possible, as soon as possible, about COVID.
12 to 16 hours a day. It was a lot of work.
It's just very selfless and just energy to push things forward.
And together they've synced data from more than 75 hospitals, billions of pieces of information, so that scientists can dive into it, explore, uncover trends, and find answers to the questions haunting people around the world. This was no easy task. You see, the data coming in from all of these places was dirty and cluttered. For example, there were more than 1,500 codes for diabetes alone, and not all the hospital systems defined it the same way. So this team had to clean up all of that data so that it spoke the same language.
So for example, if let's say we're ordering from Amazon rice, but let's say it didn't come with the units of how many grams or kilograms or pounds. And so it was random whether or not I got a 5-pound bag or a 25-pound bag or a 100-pound bag. I would get a different amount of rice than I was expecting. So we see that a lot in the clinical data where we have babies that weigh 100 pounds and we know that those are incorrect values because babies don't weigh 100 pounds. And so we have algorithms that can repair data.
Here's how this super cool platform called N3C works and why these women are so geeked about it.
When you have a database with millions of patients, you're able to discover a lot of patterns that you can really do a lot of fun exploration. And then the other fun part is that there's cool ways of visualizing the data too.
There's information on more than 16 million anonymous patients to explore and more than 6 million COVID cases. They've uncovered powerful discoveries that impact people's lives and public health decisions. Like people in rural areas are more likely to die from COVID. People in special patient groups, like those who've had organ transplants or cancer, also benefited from vaccines, reducing their risk of getting COVID. With all this data, they also saw trends in people with super rare diseases that no single hospital could otherwise know.
In terms of a platform, N3C is to a data scientist what TikTok is to a 7th grader, right? It's, a place that they go to learn and create and solve problems, just as a 7th grader goes to learn some things and dance. If you're interested in solving puzzles and being creative, this is a great space to be in. Probably most of the people who were working on the project were those kind of people, like they just wanted to solve it or be a part of helping to solve the puzzle of COVID which is still a puzzle.
And at the end of the day, you and I may have a lot more in common with these unsung science heroes than you might think.
Recently gotten into hiking.
So I have a dog. I have a corgi named Esther.
Kayaking.
Love to cook and anything that relates to hunting, gathering, cooking, eating food.
I like building furniture.
And I also make wedding cakes.
And they have a message for the next generation of women in STEM.
We need more of us there, so we have representations.
People really need to be aware of, especially with people who are kind of underrepresented, is that a lot of what pushes people into getting a PhD is somebody saying, I see you doing this. I think you're capable. And when you see somebody who does the job see you that way, you start to believe in yourself a little more.
So if you're considering it, if you're wondering if it's not going to be a place where you feel comfortable, where you can find a community, I would say take the leap and do it, because I have found a community and I have found incredible women scientists who are doing super exciting work. And I can't wait to see more of that as time goes on.
I think it's a great environment, and these young people can, meet famous scientists who are working on their science projects and really just join in and listen and learn and ask questions and contribute.
Thank you so much for listening.